All right, let's go ahead and get started. Let me share the agenda here. And now we're going to turn it over to our guest speaker, Laura Chowning. And she is the Community Engagement Partner and Community Connections and WellCare.
Thank you so much. So as mentioned, my name is Laura Chowning, and I work for WellCare Health Plans of Kentucky. I serve on our Community Connections team, which I will talk a little bit about in this presentation, but also we'll share with you our 2021 Medicaid value-added benefits for our members. But WellCare of Kentucky is a managed care or government-sponsored healthcare provider. We provide Medicaid as well as several Medicare products throughout Kentucky. We serve a total of 467,661 Medicaid members in Kentucky. So my guess is that several of you on this call today know of WellCare Medicaid beneficiaries, folks receiving Medicaid through WellCare. And so today we'll look at how we at WellCare approach our system of care for our members. We look at things holistically and customize our approach to care for our members based on their unique physical, behavioral, pharmaceutical, and social needs. We utilize a clinical platform that identifies and separates those members into those four areas: that physical, behavioral, pharmacy, and social needs. And our Community Connections team specifically, of which I serve on, addresses those social needs. We look for those social service organizations and entities who are addressing social barriers to quality health outcomes, And so when members are connected to services like a job, education, utility assistance, we see there is improvement in their medication adherence rates. We see an increase of independence, so less dependability on other services. We see lower hospital admissions, and we see improved physical and behavioral health outcomes. We know if an individual is struggling in that social area, lacking quality food, lacking that job, that educational assistance, that utility services, that their focus is probably going to be on feeding their family and not necessarily their physical health. And so we want to address those needs. And so our team's mission is to meet members where they are and support them by removing those social barriers. And we do that through data-informed decision-making, program evaluation, strategic local community partnerships, and industry-leading innovation pilot projects. And I won't go into a deep dive and detail of specific projects that we have within our Community Connections team, but can follow up with folks on the board to provide you a one-pager of our Community Connections team, as well as information about our Community Connections helpline, which is a toll-free number that anyone in Kentucky can utilize to find social service organizations and resources within their local community. And that's for members, WellCare members, as well as any other individual looking for those services. So why do we focus this way? The U.S. has unsustainable, rising health and social service costs with a marginal impact on health and well-being outcomes. And so we're looking at ways that we can see a measure that meets those socioeconomic needs and those social barriers, and lower that healthcare cost. And so, again, we integrate socioeconomic solutions into a whole person care model and support community partners in preparing for a formal integration into our healthcare system. Here you will see our team. This is a map of Kentucky, and we're divided into several regions. And so I serve the 20-county Bluegrass region, so Fayette, and all of those counties that you see surrounding. And then these are my team members. My dog says hi, and I do apologize. And then our leadership team there at the bottom of the screen. And so the impacts of health, we know that 50% of our health can be traced back to our zip code. That is those socioeconomic factors: education, job status, family, social support systems, income, community safety, so where you live, where your neighborhood is, that physical environment. Then the 30% is involved with those behaviors: tobacco use, diet and exercise, alcohol use, and sexual activity. And then that 20% happens in the healthcare system, as the individual is seeing their local provider or in the emergency room where they're accessing care. And so the impacts of social determinants of health, we know the economic stability, neighborhood and physical environment, education, food, community and social contact, healthcare systems, all of these areas impact our health outcomes, and our health outcomes being mortality, life expectancy, healthcare expenditures, health status, and functional limitations. And so our community connections team, that's what we're here to address for our members, as well as look at ways that we can help local communities in sustaining social service programs to address these things for communities as a whole. And so you can see those examples here of some of the areas that we address in our work. And let's leave it there for a second because it's a lot of text on one slide. Okay, and so now I want to cover our Medicaid value-added benefits for 2021. And so these are the benefits that our current Medicaid population, our members, will receive this 2021 year. And so we know that nothing is more important than taking care of yourself and your family. And so this is a no copay, no cost Medicaid program, 0 copays and extra benefits at no cost to the individual. And what members will receive, we I guess it was a year and a half ago, 2 years ago, we held focus groups throughout the state, and we asked them if they could add anything to their health plan and or keep anything, what would it be? And these are the answers that they provided. They wanted enhanced vision care. They asked for a bigger over-the-counter benefit for families as a whole. They asked for more healthy reward options and ways to redeem those availability of rewards. And then they asked us to keep everything else as we had it. And so we know that vision is very important. So adult vision benefit will give members more this year. So they will receive free new glasses or contacts every 12 months, and that's an allowance up to $150. They will receive free eye exams every year. And then our members, under the age of 21 get glasses every year as well. So free second pair if the first pair is broken or needs to be replaced, and then free eye exam every year. Next are those over-the-counter benefits that I mentioned that folks were looking for, or our members were looking for better utilization and increase in benefits. And so this year, they receive up to $300 worth of over-the-counter items per year. And when we talk about over-the-counter items, those are their aspirin, their vitamins, diapers. There are just a number of products available to them through this program. It offers free home delivery. As a member, they would need to order online. They can utilize their member portal, or they can call customer service. Any of those three options allows them to order each month. And it is after they order monthly. So a one-person household can order $10 worth of product each month. Two-person household, $20 per month, and a 3-person plus household can order $25 worth of products per month. And then an exciting new development for our Healthy Rewards program is these premium rewards. And so for qualifying healthy activities, so as our members do specific healthy activities within their program, Amazon Prime membership will be received 3-month increments. And so they would have to re-contact customer service every 3 months to receive the Amazon Prime membership benefit. They also are eligible for $25 Visa gift cards as they meet certain healthy rewards, as well as Fitbit devices. We also have been advised by our members that they wanted help in proven weight loss programs. And so we have partnered with Weight Watchers, and this year offering free 6-month Weight Watcher online membership for members ages 13 and older. And then members are identified through our case management or disease management program. So if a member is already working with a case manager, or they are interested in working with a case manager because they believe they qualify for Weight Watchers, they can contact their case manager to sign up for this reward. The member qualifications for children, it is 13 through 17 years old with a BMI ranked at 85% or higher. The adults 18 years or older with a BMI equal to or greater than 25. And for our pregnant members, our women who are with child, we are offering additional benefits for them, including cell phones. So a free cell phone at $250 value with unlimited data, talk, text, for those who are qualified, and they can stay in touch with their care teams and utilize that cell phone for their personal use. Extra for moms and moms-to-be as well is a choice of a free stroller, a portable playpen, a car seat, or 6 packs of diapers. And again, they would contact customer service to ensure that they utilize that benefit. We again are offering a free mobile health app called Text for Baby. They offer health tips on pregnancy and the baby's first year. And then a 24-hour nurse advice line. They can call this line anytime, day or night, to talk to a nurse when their family member is sick, hurt, or needs medical advice. And we actually have that 24-hour nurse advice line for all of our members, not just our pregnant members. And then for children, offering them opportunity to live healthy lives and grow. Boy Scouts and Girl Scouts, we have partnered with them again this year to offer free annual membership. We pay for that membership fee for members in grades kindergarten through 12th grade. There is a $25 reward towards the cost of the uniform, so we'll pay towards that uniform. And then also there is a free membership for parents or guardians who want to join that Boy Scout or Girl Scout troop as well, but we do not pay for their uniform. We are offering free physicals for children ages 6 to 18, 1 per year, and it should be provided by their primary care physician. That is noted in their plan when they sign up. We offer free GED testing for members age 16 and older. And we're excited this year. There were some changes, and we are now offering 1 voucher for each test. So they can request to take the 4 tests at separate times. In the past, they were required to take all 4 tests at one time, and that was a little bit of an issue for folks. And so there has been changes in the way that they can utilize that GED testing, but we will pay for those vouchers for those individuals interested in GED. And then we also, this year, brand new, are offering college scholarships. It's $1,000 scholarship awarded to 50 members total, and that's 50 members across the state, age 18 and up, and attending a college or a university. And I have not had a conversation with our member experience folks regarding the scholarships, but I know that in February, we were still trying to get folks to sign up. And I would think it would go fast because it's 50 members out of 400 and some thousand. So if you know of members who are interested in college, I would have them to contact member services so that they can find out more information on that scholarship program. And then for all members, we want to look at ways that we can meet folks where they are to assist them in moving forward. And we have a cell phone program, free wireless cell phone with 350 monthly minutes, 3 gigabytes of data, and unlimited text messaging. And then we have a Steps to Success training program, which offers free training and financial education classes for our members. One of my favorite member benefits, and I can offer a full 30-minute presentation for anyone who is interested on our WellCare Works program. This is a free resource that offers tools to help members learn, train, and prepare for steady employment and or volunteer opportunities. So it's a portal that our members sign up for through their membership portal, And the reason why I like to provide trainings to members of the community and local community partners is that often our members need a little bit of assistance in just navigating that website. It is full of resources. There are coaches, career coaches, who will have conversations with members about their interest. There is a way to sign up for job alerts. There are a number of video-based trainings. There is information on networking and how to network with the community and local job programs, as well as job alerts, if I didn't already say that, and just a number of information. And so if anyone is interested in that, I did fail to put my email on this presentation, but I will drop it in the chat box when I finish. So another resource that we offer at WellCare is the criminal record expungement. And that is that we pay for the $40 fee for receiving a expungement certificate. And so followed by law, they receive that certification only. That process, they contact customer service, request that expungement. It is received by a staff member who puts that request into the administrative office of the court, who sends that off to the Kentucky State Police. It takes about 60 to 70 days. They send that certificate back, and then we mail that out to the member who is required to take that certificate to the local court of which they received that criminal record in order to finish that expungement process. And then as noted a moment ago, I do apologize. I've got a little bit of a stuff in my throat. Okay, so we're committed to our members and our communities. And in doing so, our Community Connections team, the team I serve on, we are ensuring that our records and our resources are full of the local community-based organizations, such as our homeless shelters, our educational services, our support groups, our volunteer opportunities, so on and so forth, as you see these examples. And as we update our database with local contacts and local resources, again, anyone in our community can contact our Community Connections helpline, that number that you see here. And then our members, of course, we want them to utilize this resource to assist them in finding assistance programs as they meet those social service barriers or social health barriers. And we know that in providing community connections, one second. My apologies for that. So we know as they meet those community connections, that we see here what that data looks like. Now, this data is from 2019, analyzed our members as they utilized that Community Connections helpline. And we see that 5.5 times they were more likely to have their annual local provider visit, their primary care physician visit. They were 1.4 times higher or more likely, to improve their HbA1c results, and then 1.7 times more likely to improve their functional status. As we interacted with members who were calling our Community Connections helpline, of those surveyed, we noted that 50% stated they would recommend WellCare to a friend or a family member. And among the general Kentucky membership, this rate was at 54%. And then these are just services that we continually offer here at WellCare. 24-hour nurse advice line. A member can contact them day or night when they are sick, hurt, need medical advice. Again, that Community Connections helpline that will connect anyone in the community with community service such as utility assistance, food banks, and transportation. Our customer service line. So if our members need assistance with their ID cards, changing their primary care doctor, they need to receive their member handbook, they have questions about any of the member benefits that were noted in this presentation today, that is the number that they're going to contact our customer service. We also have a 24-hour crisis line that assists members with drug and alcohol abuse and behavioral health emergencies. And then we also offer free a meal program for members who are discharged from inpatient hospital, behavioral health facility, rehabilitation, or skilled nursing home programs. And so then just a quick overview of our 2021 benefits. No cost Medicaid, better vision program, bigger over-the-counter support, more healthy rewards, a new Weight Watchers program, healthy moms and babies program, activities for children, and our WellCare Works program. And that is the end of my presentation. I will come back on video. And if folks have questions about anything that I presented or need more information, I am here to answer those questions, hopefully, or find the answer for you and get back with you. Any questions for me?
Yeah, thank you, Laura, for the presentation. That was very good. I do have a question about the membership. Who can qualify for the membership and what kind of documentation do they need to qualify?
Okay, so I am not I believe Miranda will know, but I do not enroll folks in Medicaid, but anyone who is eligible for Medicaid can receive and choose to be a member of WellCare's program. So was it Miranda who helps folks sign up for Medicaid?
I think either myself or Victoria could respond to that. I mean, essentially, Medicaid is based on income, right? So you have to be under 138% of federal poverty level, but children who can get K-CHIP can be up to 218% federal poverty level. And those levels are adjusted every year. So I think they just put out the new ones for Kentucky.
Yeah, we just had the new ones.
And it's income based, and then obviously citizens are eligible, permanent residents are eligible. There's a 5-year wait for adults who are permanent residents, but children are immediately eligible for Medicaid. And then some other immigration statuses, of course, refugees and asylees are eligible for Medicaid, and people with U visas may be able to get Medicaid. T visas definitely can get Medicaid. Other than that, we kind of get into the weeds, and it really depends. But it doesn't hurt for someone to do an application, because the application information is confidential and is only used to determine if they're eligible for Medicaid, and it's not sent to USCIS or ICE or any other federal agency, just within Health and Human Services. So there's no harm in applying. During the pandemic, Kentucky's made a type of temporary Medicaid more available, which is even available to undocumented and people with DACA. But it's temporary. It only lasts for up to 3 months, and may or may not be renewable for a second term per year. And those members in the temporary Medicaid are all automatically enrolled in United Healthcare, so they don't get a choice of MCO. And WellCare is one of the choices of MCO for regular Medicaid. That may have been more information than you wanted, but.
Thank you, Miranda. And I have a second question, and it's language. Like, can people find this information in another language different than English?
I know that we have Spanish materials. I honestly have not checked our website to see if it translates over as it should.
They do have it. They do have a Spanish. A lot of members from Medicaid, I have seen them, because they all the, for KG and Medicaid, they get information in Spanish. They do have, when you call the line, they have an interpreter, or they have also somebody that speaks Spanish. Because sometimes I help members to connect with WellCare. The reason is because either they want to change the managed care organization or something like that, or either they need information, but they do.
And if someone who speaks a different language, as Victoria noted, when they call our customer service line, we have interpreters who will assist through that.
Great, thank you.
I did have a question, and I had to ask you this. I was very interested about the legal services. Just any kind of legal services? And the reason I ask you, because many of the families, sometimes the legal aspect for them, the Hispanic community, they would have questions either about, could be divorce, could be maybe questions about, just in general, somebody got a ticket and now it's in jail. And did you offer that kind of legal services, or what kind of legal services are you offering there for those members for WellCare?
So I honestly have not been doing member services very long. Our teams just merged recently. So Coast, who used to be on our community relations member services team, who would have presented, but she's changed positions. So what I'll do is send you the handbook, the member handbook, that lists out every single one of the member benefits that are received, and that will walk through if there are legal services provided. But that is a question that I honestly do not know the answer to, and I do apologize for not knowing. But we'll find out.
In the scholarships, I'm sorry, I had to ask you. You said that you don't know much about. I saw $1,000 and it's only for 50 members, like just 50 members, and that's it. It's over. Yes. Just okay, which is, I mean, it's nice.
So the first 50 people to sign up and qualify will receive those scholarships, the $1,000 scholarship.
Do you have a link or anything that you could share with us for that?
Yes. One moment, I'm going to put my email in the chat box, and then I'll pull up our website and put some links in there for specific benefits.
That'd be great. Thank you.